Hi, welcome back. Chris Steller here again with Pinnacle Training Consulting Systems. This last video section is covering Unit 5, and it's talking about how common dysfunctions develop. In the context of injuries or how people develop dysfunctions, there's 5 major ways. There's degeneration, there's trauma, sedentarism, systemic pain, and going to be referred pain. When we think, repetitive strain injury, not referred pain, excuse me. So when we talk about injuries, when someone is degenerative, those are things like a tendon breaking down over time. And that could be something due to a postal worker that's following a nail this way all the time for so many years in one direction all the time. One day it is to have tendonitis and becomes inflamed. Or someone like a farmer who's baling hay, lifting up the hay every day, the same way for how many years, and one day his shoulder gets hurt and he can't lift his arm up. To trauma, falls, baseball players, we all have falls and we see that with our clients. Trauma can affect the articular tissue, the extra-articular tissue, muscles, tendons, ligaments. So it's important understanding what injuries are occurring and what's going on in the body. Repetitive strain injury is what it sounds like. If something's doing this all day long and they're stepping, or they're stepping like this, they're causing forces, vibration, they're causing abnormal stress to an area. That's going to lead to breaking down. And I think the biggest thing to understand is that that leads to failure and eventual injury. In the next session, we'll talk about some common orthopedic injuries, going to the spine, shoulder, hip, knee, and ankle, and discussing the pathophysiology of the condition, which I use with models. I'm going to talk about some medical management, and most importantly, evidence-based training that makes sense out there so you can actually follow it with the manual and use it with your clients immediately.